how to treat pain after surgery is something that patients often worry about quite a bit. At this point, almost all my surgeries are outpatient, and the way we're able to achieve this is by controlling people's pain using a combination of medicines rather than relying on narcotics alone. Narcotics are often needed during postoperative care, however, they have significant side effects, causing itching, drowsiness, grogginess, and unfortunately, after about 4 days, a chemical dependency. For this reason, we use a system called multimodal pain control to try and treat pain using minimal to no narcotics. This starts with your anesthesia discussions. Your anesthesiologist will often talk to you about nerve blocks, and these nerve blocks can help with pain during surgery and in the immediate post-op care situation. As far as your medicines, everyone will go home with some sorts of pain medications. In the vast majority of cases, that means we use a combination of medicines including acetaminophen or Tylenol, meloxicam or Celebrex, which are both anti-inflammatories, and in certain patients, gabapentin, which is a medicine that acts on the nerves. These medicines, in conjunction with cryotherapy, can minimize the need for narcotics. After surgery, almost everyone will get a prescription for oxycodone, which is a safe medicine to use sparingly for the first few days after surgery. I do encourage you to only use it if necessary, and by day 4 you should be off of it completely. It's almost unheard of for me to refill narcotic medicines after surgery, so if that's the case, then we need to talk about specific changes to your pain control regimen that could be beneficial. It can be confusing after surgery on what exactly you're supposed to do with all of these medicines. In most cases, we schedule a lot of these medicines, and what that means is taking these medicines on a preset schedule without regard for your actual pain levels at the time. What this does is prevent spikes in your pain, which can get you into an uncontrollable cycle. For the most part, we use acetaminophen or Tylenol 3 times a day, typically when you wake up, around lunchtime, and at dinner time. We use an anti-inflammatory once or twice a day, depending on what we've prescribed, and occasionally the gabapentin as prescribed 3 times a day. Taking these medicines on a schedule means that you don't have to think about whether you're having pain or not, you just take them until we talk about it in clinic again. Oxycodone or any other narcotic can then only be used as a breakthrough agent. It may seem like a lot of pills and a lot to keep track of, but it's a lot better than having spikes in pain that require narcotics. Nerve blocks themselves work great, and they can really help with your pain control after surgery, but be aware that the extremity will eventually wake back up and have some of the pain that you would have had after surgery. Taking these scheduled medicines can minimize this transition and make it much more tolerable. We have someone on call 24/7 if you have issues after surgery. However, otherwise give us a call during business hours and we're happy to talk about it further.